Dr. Manison, we just spent a whole weekend with you training the other clinical advisors and some new great things that we're going to do with StemWave. But I personally have been able to be near you during some of our trainings with colleges and pro sports teams. And the thing that always stands out to me is you talk about some of these amazing stories that you've seen StemWave do on patients, some of these miraculous things. Talk a little bit about some of the stories that we've all heard, but now a lot of people can hear about what you've seen StemWave be able to accomplish.
Well, there are a lot, and I have a lot of case studies to discuss. In fact, it's one thing to tell a story, but then sometimes we have to, really back that story up with truth. So some of the cases I'll discuss with you, and obviously, HIPAA breach or anything like that, but I want to get them to be published. I think that's extremely important. So in kind of a vague way, I'll tell you what's going on. I've had athletes, teenage athletes who have had clavicular fractures, and it was on the medial 1/3 of the clavicle. And medically, we know that area is a little dangerous due to the brachial plexus. So we have vascular components, we have nerve components. So they're not going to go in there and do that much in that area. Ordinarily for care, they're going to sling that shoulder and take about 12 weeks before that athlete is then advised or allowed to go back to sport. That's a problem. So I had a particular athlete who had that particular type of fracture. And, there's really nothing in the research on this. There's only one study on a distal clavicular fracture, but nothing on the proximal side. And I started using StemWave, unbeknownst to me, like I know it works. I know the regenerative effects. I study this inside and out, day after day. You guys know that. And I love teaching it. And we found with X-ray validation, almost every week, because she was going back to see the orthopedist, that the shoulder was actually healing and healing and healing. It was absolutely amazing. And at 7 weeks, she was able to go back and play her sport.
Wow.
And that's unheard of.
7 weeks.
We have to publish, because the power of the ability of regeneration and angiogenesis, basically, not to use too many big words, but in terms of the body's ability to build new blood supply or heal the blood supply that's already there, and then encourage the body's own innate immune system to bring in stem cells to actually heal the tissue, is really unmatched by any other way, especially in the bone. And it's really untouched by really anything else. Everyone needs to learn about this. Everyone in orthopedic medicine, the sports, chiropractors, the physical therapists for sure. Definitely, as you know, with the university you've been to, they know about it, and the pro sports teams, they're well aware of it. But we need the general population and healthcare system to learn about this because it's extremely powerful. If I may, I'd like to discuss another one.
Yeah,
this one involves nerve. So I like to cover different areas. Generally speaking, when people have nerve damage, and I'm speaking about like a nerve palsy, a cervical spine nerve palsy, we know that there's generally a window accepted, not 100%, but accepted, that it's going to be about 3 to 6 months to really have that nerve start regenerating, right? And so in the case when that doesn't occur, usually that's going to lead to a permanent form of paralysis. I had a particular patient who started care with me at 11 months after I'll just say a surgery that didn't go well.
Yes.
That individual was extremely skeptical, very bright individual, very highly trained, very skeptical, because obviously looks to the research, doesn't see anything in there.
And at that time, that most people would say there's nothing we can do, right?
I actually sent the individual to a neurologist who I work with, a neurosurgeon who I absolutely love. He's spectacular. And he advised or recommended another form of a surgery, actually, to help the patient to kind of resect nerves. And the patient was obviously very nervous because it was during the surgery that the palsy occurred. So he obviously didn't want to do that.
Sure.
And he said to the surgeon, he's like, well, Dr. Manison talks about this shockwave thing. And the surgeon, who's a friend of mine also, was at that time not overly familiar with it. And he goes, well, I don't think that will work, or probably you need the surgery, whatever. So the patient came back to me, skeptical already, then comes back and says, your neurosurgeon, who's very highly regarded in my area, I mean, he's absolutely brilliant, he said it probably won't work. And I'm thinking, oh boy, I have like the total odds against me right here. Like, I really have to come through on this or I look like a total idiot. So we started a protocol, which I had to create for that. There's really nothing in the research on it. I'm at 4 months. She has a muscle strength of 4 back in the deltoid, which is how we were assessing the C5, obviously. And he'd been in physical therapy the whole way through, just trying to keep function, not allowing things to freeze up, not to get any type of adhesive capsulitis in the shoulder or anything else. 3 months after that, muscle strength 4.5. At a year mark, he was at full recovery.
Wow.
From a complete C5 palsy paralysis. So the interesting thing about this is in chiropractic school, we have national boards part 4. And they bring actors in, and the actors will act out certain conditions. I think when I had my part 4, God, it feels like generations ago now, but I think one of them was like a C5 pause. Like the deltoid didn't work, and I had to define what it was and what was caused by, and what, cervical level and everything else. So, we always learned also that this could never happen. I've never seen a 0 deltoid before in 25 at this time, 24, 25 years of practice. So it totally blew my mind. So when we developed this protocol and it worked well for him, I had already spoken with the neurosurgeon, and I said, I'm going to use the protocol. If this patient were to get better, will you see this patient again and confirm what I'm finding? And then if that happens, would you be interested in writing this up? And the surgeon really didn't believe that the patient could get better. And so the patient has already seen, I'm in that phase right now, is either going now or has gone already, I haven't heard yet, back to see the surgeon. I did speak with the surgeon about it, though, a second time. And if he's all better, which he is, I'm very excited. We're going to write this up for publication as well. It's extremely important. One of the areas with StemWave, and that is not discussed because we think about all the musculoskeletal components. We think about the joints. We think about the bone healing. We think about the muscles, the tendons, the ligaments. What about just purely vascular problems along with neurological? So people who are really suffering with things like chemotherapy-induced, neuropathies. Mm-hmm. These are really horrible conditions. Usually people get it in their hands, their feet, or both. It could be a lifetime type of problem because the actual chemotherapy is damaging through chemical means, kind of like we can think of it almost like an acid, but it's damaging the capillary beds along with the free nerve endings. What can medicine, chiropractic, PT, no one can really do anything for this at all. I've had a couple patients. I've been blessed to be able to help people with these conditions. I have a particular individual who's a good friend of mine, actually, and he's a head trainer at a facility, and he had a couple courses of chemotherapy for lymphoma, actually, and it took him a year to call me to ask if the StemWave could actually affect his system. In fact, he calls me up and he goes, Alan, he's a good friend. He calls me up my first time. He goes, Alan, does StemWave help feet? And I'm thinking, he's got some probably, calcaneal stress reaction, maybe some plantar fascial issues, plantar fasciitis, something along that line. And he goes, it's amazing because you send all the people into the gym and they have muscle problems, joint problems. The StemWaves really helped them with all these things because I use that facility for all my post treatment, rehabilitation, which is very important, right? We need to find the cause of problems. So many patients have issues. We treat them, right? On the medical side, medical doctor, chiro, PT, whatever. And then when we're done with them, we want to make sure that that same problem doesn't come back. So it's always great to have the proper rehab and conditioning afterward, besides just musculoskeletal, it's confidence, all that great stuff. But anyway, he is really used to people going in the facility and he's training them with back injuries, ankle, knees, shoulders, things that I've been working on with StemWave. So he never thought that this could help with anything like, effects of like cancer treatment, right? So he calls me up and he says, and he asks me again, he goes, what about my feet? And I was thinking it was a foot problem. He goes, no, from the chemo. And I'm like, I don't know. I haven't really tried this before. Why not? I know it's safe. The Hippocratic Oath, above all, do no harm. I've got that down. No problem. Come on and let's give it a try.
And that excites you. That stuff I know gets you pumped up to like try where we haven't explored yet, right?
I love it. I do.
Yeah.
I've been doing this 26 years. Every patient success is like the first one to me. Like I live for this. And I think it's so important for doctors of all disciplines to love what they're doing and to be like intrinsically motivated by it. You do it because you love it. Sure. I mean, we're not going to sit here and talk about business aspects or I've got to, pay for my family's this, whatever. We all get that. Everyone's got a job for a reason, right? But the ability to have a job where you can help people get better, improve their quality of life is to me unmatched by anything else out there at all.
Yeah. So that patient that had the nerve damage with the shoulder, that StemWave got them better. What was that patient's reaction after he was told like, you're going to need another surgery or potential it's not going to happen at all? He
was skeptical until we were pretty close to the initial care plan on it. He is ecstatic because he can move again. He can function. This individual was a very high level tennis player. He can now work out. He can play tennis. It was life-changing, 100% life-changing. The other gentleman with the chemotherapy-induced neuropathy, I'll go back to that if it's okay.
Yeah.
We had several treatments with him, probably, I don't remember the exact number, but probably somewhere in the range of about a dozen treatments. No more tripping and falling. no more neuropathy, a little bit of burning in the toes when he wakes up in the first thing in the morning. But guess what? He can walk his dog. He can exercise. He can do everything he wants to do. No inhibition. It's pretty bad being a trainer and tripping around in your gym. It's really nice when you can do everything you want to do, because then you can take better care of yourself. So every case with this, is extremely exciting. There's just story after story after story.
I know.
I mean, and these are real patients. I'm a real doctor. People can look me up. These are real patients. And that's why I want to publish them, because it's one thing to talk about it. It's another thing when the whole world can see it and learn from it. And then other doctors will want to take that step and help their patients as well in the same fashion.
And StemWave is a real thing. These stories sound incredible, and people might think like, oh, there's no way, but this is a real thing. The data's out there. The science is out there. How would you explain StemWave to someone that's not a doctor, just like layman's terms, like a simpler form, like when you're talking to patients? How do you kind of explain StemWave to them?
Well, layman's terms, very difficult, as you know, because I'm very, very big into the science.
Yeah.
Basically, when we're dealing with a true shockwave, and there really is only one form of a true shockwave, it's an explosion, and it occurs over a very, very short period of time. So there are a lot of devices, a lot of technologies out there that call themselves shockwave. The problem is that the shockwave is really only produced by a plasma bubble imploding, creating a radial wave, and then exploding and creating a shockwave. Well, that shockwave has really unique effects in the body. But the biggest thing that I like to get across to people, and I articulate, is that there are very few things that create new blood supply in an area. And there are very few things that are going to stimulate and bring about the innate immune abilities, function in regards to bringing in stem cells to heal tissues. That's the big thing. And yes, there are medical interventions like PRP, and PRP works great with StemWave. It works great on its own. But with StemWave, it's even that much better. And the research shows that with shockwave, it works better. But when we're working with patients, and a very easy way to get it across, look, your body has an injury. I've tried other things. It's not working as well. I need to shake things up in there a little bit. I need to get shockwave in there to increase the blood supply. By doing so, I'm getting more nutrients in and stem cells that helps to heal the underlying tissue. As that's healing, I can then use my other skill sets, as a PT would do, a medical doctor would do, an athletic trainer would do, an OT would do. We'll use our other skill sets to then address that area, correct the problem, and then make sure it doesn't come back again. And this is great whether it's a pre-surgical type of trauma or injury, or even post-surgical. You think after surgery. So let's address that for a minute. After surgery, not only does the patient have to heal from the actual injury, and if they're stitched or there's meniscal stitching or other types of problems, but also from the wounds going in from the surgery. And the post-surgical results are amazing. If you can use StemWave on an area that's been operated on, and I know I cannot make guarantees because it'd be completely improper and incorrect, and medical, legal, ethical can't do it. But what I'm going to say is with my patients, I'm seeing about a 50% reduction in time and return to play for sports. Research is showing that a little bit as well. Can't make promises, but I am confident at this point taking most any post-surgical injury and having them recover in half the time. Now, that's healing of the tissue. So we can talk about ACL grafts. I have radiographical MRI proof that after a few months, the grafts are healed. But that doesn't mean the function's there.
Right.
We still have to work on loading the joint and the tissues. We have to learn how to accelerate, decelerate, and standard ACL protocols. The difference is, instead of waiting months and months and months to start all the rehab, we can start it now within a couple months, especially with proof that the graft is essentially fully healed.
And this is why a lot of college programs are bringing StemWave in now. Pro teams are using it now. That is so attractive to them to get their athletes back on the field. 50% reduction time in healing. That's amazing.
When you're dealing with athletes now in college who can still get paid, or professional athletes, this is why it's like, to me, it's like a normative therapy. If you are not bringing, StemWave into your sports program or into your orthopedic practice, now you are just falling behind, especially with the idea and the knowledge that you can get your athletes better so much more quickly. Normative therapy, it's becoming a part of everyone's office. It isn't just far-fetched early adapter anymore. It's like everyone needs to get one of these now so they can get their athletes better, and their patients, not just athletes, but any person can get better results faster that are more complete. Let the body heal itself. This accelerates the healing process. There's no question about it.
And you talked a little bit about the research is there. I've never met anyone who can retain so much data like you have. And, you're constantly talking about this study showing this with, this type of therapy. Talk a little bit about some of the key studies that you've read over the years that relate to StemWave and, how you kind of present it when you do your trainings. Like, what are some of those key studies? What are some of that data that you can share?
Well, there's a lot of research on a lot of different forms of shockwave or pressure waves. And so we have to be careful when we're talking about the research that we're covering the right form of research. So because the StemWave is an electrohydraulic unit, we can only really address studies, research that's done with electrohydraulic, especially in very specific realms. We know that ultrasound, which is a form of acoustic therapy, as well as radial pressure waves, which is like unfocused pressure waves, or electromagnetic and piezoelectric, which are forms of focused pressure waves, they are all awesome for pain reduction, through inflammation reduction, and inflammation causes most all pain. They all work really well. So I don't want to take away anything from the other technologies. What I have found in the research about regeneration, though, is that most of the best research done on the regenerative effects are done with electrohydraulic shockwave. And so I would trace back to 2004, 2012, and going forward about how we're dealing with certain what are called pattern recognition receptors, in this case, toll-like receptor 3. I don't want to get too technical, but basically, how the body works through macrophages to activate certain receptors in the body to see things that are leaking out of your cells. So when your cells are damaged, or they think they're damaged, whether it's like a virus or it's a mechanical trauma, they leak things out. And sure, they leak some proteins, they leak some lipids. That's nice. They have effects in the body. But I'm most interested in the messenger RNA. And our body has receptors, our innate immune system, we have receptors that pick up that messenger RNA, and then it kind of codes the immune system to know what to do. What shockwave has been shown to do, electrohydraulic shockwave, which is incredible, is it upregulates that system in your immune system. It's not telling it specifically what to do. It's saying you need to work a little harder and better to get this area, functioning and healing. And at the same time, it shuts down some components of the immune system that actually work against the anti-inflammatory effect. Toll-like receptor 4, not always evil, but in the case of inflammation, toll-like receptor 3 and 4 talk together. Well, guess what? If you don't have great nutrition, if you're not sleeping well, your exercise, your fluid content, you have a massive inflammatory issue in the body, you're not handling it well, your body sometimes innately, no matter how hard it works, isn't going to get it to work as well as it should. What's incredible is that shockwave does what nothing else can do. It will upregulate that anti-inflammatory effect while at the same time downregulating the component that really wants to inflame. And so when I read that, that's why I'm so excited. I'm like, oh my God, this StemWave does things that nothing else can do. That's like incredible.
So for someone who's running a private medical practice who sees musculoskeletal injuries in patients, how important do you think it is for them to have StemWave?
As I said before, to me, it becomes like more normative. Like, it's almost like if you don't have one now and you're not going to have one, you're like out of date. I can't fathom at this point a physical therapist group, chiropractic, office, orthopedic group. Everyone there needs to have access to something that stimulates and promotes and really expedites the healing process. It's no longer debatable. It's not like, it's another shiny toy. It's a sales pitch. It's a this, it's a that. The research is there. There's more research coming out all the time, which is phenomenal. And the key to it is it regenerates. The pain and inflammation reduction, sure, you can get shots. You can get different forms of soft tissue techniques. You can get all different things. There are a lot of ways to address pain and inflammation. And I'm convinced, and I'm very confident that StemWave does it better than anyone else. And that's because we are directly affecting voltage-gated sodium channels, which really shut off something called calcitonin gene-related peptide and substance P in the dorsal root ganglia. But guess what? It also helps us with secreting serotonin. Makes us feel good.
Oh, yeah.
So I could go to bat and argue with anyone about how great this works for pain and inflammation. I love the regenerative effects. How can you do advanced sports injury work or work with any patient, not just athletes, but any patients who come in? It could be someone playing pickleball in their 60s and they have a calf injury or their knee or some other problem. How do you get them better faster if you're not working on the regenerative side? That's where we're going with this. It's not just treating pain and inflammation and rehabilitation anymore. We want them better faster. We have to get them to regenerate faster. This is the best way to do it.
No, it's not a Band-Aid.
It's not a Band-Aid. It can work as a Band-Aid with pain and inflammation reduction, but our patients deserve a lot more. There's a lot of different brands of Band-Aids they can stick on. There's only one way to work on that regenerative component. StemWave is the best way to do it.